1. What is the primary goal of the Chronic Care Professional CCP program? A. To provide acute emergency care to patients. B. To improve outcomes for patients with chronic illnesses through behavior change and self management. C. To manage hospital operations and budgets. D. To replace physician led patient care models. To which of the following is a key competency for a CCP when engaging with patients? A. Diagnostic testing. B. Motivational interviewing and coaching for self management. C. Prescribing medication. D. Performing clinical procedures. 3. In chronic care management, what does self-efficacy refer to? A. The ability of healthcare professionals to manage patients. B. A patient's belief in their capacity to manage their health behaviors. C. The system's efficiency in delivering services. D. The doctor's authority in decision-making. 4. Which regulatory framework primarily governs patient privacy in chronic care? A. Occupational Safety and Health Administration, OSHA. B. Health Insurance Portability and Accountability Act, HIPAA. C. Centers for Medicare and Medicaid Services, CMS. D. Centers for Disease Control and Prevention, CDC. 5. What is the first step in developing an individualized care plan? Evaluating outcomes. B. Identifying patient goals and barriers. C. Measuring staff performance. D. Reviewing hospital policies. 6. The CCP model emphasizes which type of learning principle? A. Passive learning. B. Adult-centered experiential learning. Memorization of clinical protocols. D. Teacher-dominated instruction. 7. In the CCP model, which approach best supports patient adherence? A. Directive instruction. B. Collaborative goal setting. C. Punitive measures for noncompliance. D. Routine reminders. 8. Which of the following best describes evidence-based practice in chronic care? A. Relying on intuition and experience. B. Integrating clinical evidence, patient preferences, and expertise. C. Following a single provider's opinion. D. Ignoring patient feedback. 9. What is a major barrier to effective chronic care coaching? A. Overly motivated patients. B. Limited time and competing priorities for patients and staff. C. Excessive patient engagement. D. Standardized communication. 10. Which communication strategy enhances understanding during chronic care consultations? A. Using medical jargon to show expertise. B. Active listening and plain language explanations. C. Dominating the conversation. D. Avoiding questions to save time. 11. What is the most effective way to evaluate a patient's readiness to change behavior? A. Directly telling them what to do. B. Using validated tools like the Stages of Change model. C. Reviewing their medical history only. D. Observing nonverbal cues exclusively. 12. What is the primary role of a CCP in team-based care? A. To act as a liaison supporting patient self-management across disciplines. B. To lead surgical interventions. C. To replace the physician's role. D. To manage hospital admissions. 13. What is an example of regulatory compliance in chronic care documentation? A. Recording personal opinions. B. Maintaining secure and accurate health records. C. Sharing notes informally via email. D. Skipping non-clinical details. 14. Which adult learning technique promotes long-term behavior change? A. Lecture-based sessions. B. Active problem-solving and reflection. C. Passive note-taking. D. Memorization of data. 15. What type of evaluation measures a CCP's effectiveness in improving patient outcomes? A. Process evaluation. B. Outcome evaluation. C. Input evaluation. D. Structural evaluation. 16. Which motivational technique aligns with the CCP coaching approach? A. Giving orders to patients. B. Asking open-ended questions to evoke intrinsic motivation. C. Telling patients their goals. Ignoring ambivalence. 17. When mentoring a new CCP, which approach ensures skill retention? A. Hands-on practice with feedback. B. Long lectures without interaction. C. Self-paced online reading only. D. Observation without engagement. 18. Which of the following demonstrates curriculum development in CCP training? A. Designing modules that integrate theory, case studies, and evaluation methods. B. Using random topics each session. C. Relying solely on instructor opinion. D. Avoiding patient simulation. 19. How should a CCP address a patient's cultural beliefs about illness? A. Correct them immediately. B. Integrate cultural beliefs respectfully into the care plan. C. Ignore them to maintain objectivity. D. Replace them with medical facts. 20. What is the primary focus of the action planning step in chronic care? A. Setting achievable short-term goals with the patient. B. Recording demographic information. C. Reviewing hospital budgets. D. Updating insurance data. 21. In adult learning, what is the significance of relevance? A. It ensures that content connects to learners' real-world experience. B. It increases the volume of content covered. C. It enhances test memorization. D. It encourages passive learning. 22. What is the most ethical approach for CCPs in patient coaching? A. Respecting patient autonomy and confidentiality. B. Enforcing compliance through authority. C. Sharing data without consent. D. Prioritizing organizational goals over patient needs. 23. Which step in evaluation involves analyzing performance trends over time? A. Summative evaluation. Formative evaluation. C. Longitudinal evaluation. D. Baseline assessment. 24. What is the main objective of care coordination in chronic disease management? A. To ensure continuity and communication among care providers. B. To limit patient access to specialists. C. To reduce staff workload only. D. To standardize billing. 25. A CCP notices a patient consistently missing appointments. What should be the first response? A. Penalize the patient. B. Explore barriers such as transportation or motivation. C. Notify law enforcement. D. Discontinue care immediately. In mentoring a CCP trainee, feedback should be A. Specific, timely, and constructive. B. General and delayed. C. Minimal and vague. D. Harsh for discipline. 27. What should a CCP prioritize when communicating lab results? A. Clarity and emotional support. B. Technical medical terms only. C. Speed over understanding. D. Avoiding discussion. 28. Which of the following best defines patient empowerment? A. Providing patients the skills and confidence to manage their conditions. B. Making all decisions for the patient. C. Reducing patient involvement. D. Enforcing strict compliance. 29. Which of the following would indicate a breach of regulatory compliance? A. Storing patient data on personal devices. B. Encrypting all health records. C. Using secure hospital systems. D. Limiting data access to authorized staff. 30. What is the role of evaluation in CCP curriculum development? A. To ensure content aligns with performance, outcomes, and competencies. B. To add more theory for academic depth. C. To reduce hands-on practice. D. To shorten training. 31. Which type of communication helps build trust with patients? A. Empathetic and non-judgmental dialogue. B. Command-based interaction. C. One-way communication. D. Interrupting to correct misconceptions. 32. Which mentoring method improves problem-solving in CCP trainees? A. Case-based discussion and reflective questioning. B. Memorization quizzes. C. Passive observation. Role exclusion. 33. What is an essential skill for CCPs and evaluation methods? A. Using metrics to measure patient progress and program effectiveness. Memorizing policies only. C. Avoiding feedback collection. D. Depending solely on qualitative data. 34. The best learning strategy for adult CCP trainees involves A. Integrating experiential practice and real patient scenarios. B. Rote memorization. C. Group lectures without interaction. D. Reading manuals only. 35. Which aspect of communication is most critical in behavior change counseling? A. Empathy and validation of patient experiences. B. Correcting every misconception immediately. C. Direct instruction only. D. Limited dialogue. 36. How can CCPs ensure their interventions are evidence-based? A. Consulting current clinical research and guidelines. B. Relying on traditional habits. C. Ignoring updates in chronic care science. D. Using anecdotal examples only. When documenting patient interactions, CCPs must ensure A. Accuracy, completeness, and compliance with privacy laws. B. Minimal details to save time. C. Informal tone and language. D. Skipping electronic records. 38. A CCP designs a workshop for diabetes management. Which element ensures adult learning effectiveness? A. Interactive activities tied to patient experience. B. Extended theoretical lectures. C. Instructor-led only. Passive demonstrations. 39. Which skill differentiates effective chronic care professionals from general practitioners? A. Coaching and motivational communication. Diagnostic testing. C. Prescribing authority. D. Procedural interventions.